Good afternoon, everybody, and welcome to the kickoff meeting of the Stroke Action Plan Europe, a joint initiative of the European Stroke Organization and Stroke Alliance for Europe. This is a very important moment and event for which ESO and SAFE have been working for more than 2 years. We have representatives from 52 countries on this call, with at least 2 representatives from each scientific organization, and at least 1 representative from the respective national patient organizations. A truly unique moment, so once again, a warm welcome. Stroke remains one of the leading causes of death and disability in Europe, and projections show that with a business as usual approach, the burden of stroke will not decrease in the next decade or beyond. This is why ESO, in collaboration with SAFE, following earlier meetings in Helsingborg 3 years ago, decided to come together to review the scientific evidence and state of current services, to identify priorities for research and development, and to set targets for the development of stroke care for the decade to follow. The initiating meeting for the current process was held in March 2018 in Munich. Since then, the organizers, some of which you will come to know today, have been preparing towards this moment. As Hanne Christensen, Arlene Wilkie, and Francesca Romana will illustrate in a minute, there are crucial gaps in the chain of stroke care that require a focused and coordinated effort, regardless of geographical region and also level of care. What ESO and SAFE want to achieve with the Stroke Action Plan Europe is set up a framework that assists countries in improving stroke care, and that enables us to closely work with you, the national stroke societies and patient organizations, to achieve our aim, to improve stroke care across Europe. We will need your input and collaboration, and would hope you agree this is an important aim that can best be achieved by a structured process. Today's kickoff meeting will be followed by 3 rollout meetings, one on the 11th of November, one in December, and one in January. And Hanne and colleagues will provide you with the details. So thank you to the organizers, Hanne, Arlene, and Francesca. Thank you for joining this important initiative, and I do hope to see you soon in person. Thank you very much again. And with this, I would like to now hand over to Arlene Wilkie, who will give the first presentation.
Thank you, Martin, and thank you everyone for coming along today to this really important meeting, as Martin said. My name is Arlene Wilkie. I am the Director General of the Stroke Alliance for Europe, and I am here today to talk to you about the unmet needs of patients and carers across different parts of Europe. Next slide, please. So what I'd like to talk to you about is I'd like to just mention a little bit about SAFE, as I'm not sure how many of you will know what we do. I'd like to talk to you about why we need the Stroke Action Plan for Europe, and then I'd like to talk to you about what we'd like you to do to help. Next slide, please. So, the Stroke Alliance for Europe, we are the patient voice in Europe. We are a membership organisation, and we represent over 30 stroke support organisations in over 30 countries in Europe. And what do? We work with our members to raise awareness of stroke, to carry out policy and advocacy activities, to enable and promote the voice of stroke survivors and families. We carry out work particularly in prevention and life after stroke, and we encourage research into stroke, as well as supporting the development of stroke support organisations. Next slide, please. So, are we meeting the needs? How are we doing? Are we meeting the needs of stroke, people who have had stroke, stroke survivors, and their carers? In 2014, the World Stroke Organisation published the Global Stroke Bill of Rights. Now, this isn't a legal document, but it does set out what people have a right to. So people who have had a stroke have a right to receive the best stroke care, be informed and prepared, and be supported in their recovery. So how are we doing across that entire stroke care pathway? Next slide, please. So first of all, we'll have a look at that first point of contact when someone has had a stroke and they're going into hospital. The European Stroke Journal found that the treatment of acute stroke patients between and within 44 European countries and in many vary dramatically, and in many countries rates are far below the highest country rates, leaving many patients untreated. SAFE carried out some interviews with our members last summer to ask them about stroke care in their countries, and I'd just like to share some of that with you now. In Slovenia, they told us that patients' families have even less support than patients themselves at this stage. In the Ukraine, they tell us that there is no state certification for stroke units. As such, they have no medical speciality called stroke medicine. Therefore, stroke patients are not treated by specially educated stroke physicians, but mainly by general neurologists. And in addition to this, national guidelines and generic protocols for stroke care exist, but there is no appropriate resource for its implementation. So, in our view, looking at the data and looking at the evidence, we feel that initial stroke care is not being addressed adequately. Next slide. Now we look at when someone leaves hospital and we look at their care after they've had the stroke, once they've left hospital. This is where things get really interesting. In Germany, they told us that there is no structured, standardised care management for stroke patients when they return home. In Ireland, they told us, in therapy terms, patients effectively walk off a cliff after they pass through the hospital gates. In Spain, they say life after stroke is the poorest point of the care process. In the UK, thousands of stroke survivors do not receive the support they need when they leave hospital. In the Czech Republic, they told us, due to deficiency of post-stroke services, stroke survivors leave for psychiatric hospitals or institutions for mentally handicapped people. And North Macedonia outlines this very nicely. Every stroke is different, and so the recovery that follows is different. Patients suffer not just physical problems like weakness and impaired gait, but also difficulties with language, memory, cognition, and emotional problems. Patients and carers, everyday life changes and become full of obstacles and frustrations. And we know right now in this current pandemic, this part of the care pathway really has fallen apart for many people across Europe. Next slide. Now, I know that there are good practices across Europe, but this isn't consistent for all patients and for all carers. We know that stroke is the leading cause of early death and disability, and we know that stroke numbers and the costs are increasing, as Martin outlined. The data shows us that disparities between and within countries along the entire stroke care pathway exist, with post-stroke care being neglected by countries. Really worryingly, many countries do not have a specific strategy for dealing with stroke and supported with appropriate and adequate funding. And my call today is that while we know there is good care, it is not consistent and it is not good enough across Europe. So this fuels the need for a stroke action plan to confront stroke and its impact on our European citizens. Next slide. So at this point, I'd like to ask the audience a question, and I'm hoping that a poll is about to pop up in front of you. And I'd like you to read the poll, and I'd like you to answer the poll. I'd like to know, and not just myself, but also Hannah, Francesca, and everybody else on the panel would really like to know, is anyone in your country working to implement the Stroke Action Plan for Europe? If you please press yes, no, don't know. And I will ask our controllers to shut this poll down after a few more seconds. And once we've done that, we can move on to the next slide. And Richard, if we have the results, that would be fantastic to see. So this shows us that less than 50% of the people in this room believe that someone is working to implement the Stroke Action Plan in your country. We've got more to do here. I think this initial poll immediately shows us that we have an initial issue here with the action plan not being implemented in each other's countries. So what do we want you to do today? We want your help. We want you to help us. The global burden of disease has told us that stroke is a leading cause of disability, but it also showed that if we do more interventions and services, we can show improve outcomes. So we need you, and we need you to take action. So today the other panelists are going to outline for you how we're going to work with you to implement the plan, and we would really like you to commit to work with us to improve quality and outcomes for people in your country, to work with us to implement the Stroke Action Plan in your country, but also to work in partnership. So we have stroke support organisations and national scientific societies on this call, but we really want you to reach out to those who work across the entire stroke pathway, as this will equip you with the strongest voice to implement change. Thank you, and I'm looking forward to hearing the rest of the presentations and addressing your questions. Next slide.
Thank you, Eileen, for this very thought-provoking and sobering talk. Now we have time for questions on the chat. So,
okay, so my name is Urs Fischer from the University Hospital in Bern. So if you have questions, please use the chat function on Zoom, and then I will read the questions, and I will ask the speaker to respond. So Arlene, there is one questions coming in. What do you think is the biggest barrier to the implementation of the Stroke Action Plan in individual countries?
I think for me, the biggest barrier will be making sure that the people are working across the entire stroke care pathway, and that is the barrier, bringing together not only our academics and our researchers, but our stroke support organisations, our patients, our carers, our neurologists, but also the therapists, the people that are involved in the whole pathway. Without bringing in everyone across the whole pathway, we won't be able to influence that whole care pathway that patients and carers absolutely deserve. So I think the barrier is bringing everybody in to make that change right at the start, and I would encourage everyone to look at that right at the very start of their work.
Excellent. There is just a second question coming in. One person was writing, I am already involved in working on implementing the Stroke Action Plan in my country. How can we make sure that we work together on this? So what is your response?
I think this is, again, a really good question, and it's one of the reasons I was interested in the poll. So what we will do is we will look to see who is looking at the Stroke Action Plan in your countries, and I would love to contact you afterwards and work out with you how you are doing this. We need to work in harmony, we need to work together, and what I'm hoping is that you will share with us how you have been working on your action plan, and we can share with you the work that we think will help enhance the work that you're doing. So harmony and collaboration is the way forward, and please reach out to me, and we can work out how we do this all together.
Great. There is another question coming in. Is there a list of persons responsible for developing the Stroke Action Plan in each European country?
If that's directed to me, Urs, I don't know that answer at the moment, but I think it's an excellent question. I think beyond these meetings, as Martin set out, there are three follow-up meetings, and through those meetings, I think we should try and create that list of who's responsible, so that we have one body that everyone can work with to implement these plans.
Great. Next question. How many countries have a member of the Department of Health in charge of providing life after stroke care?
I don't know. That might be a good poll question. I don't know that question, Peter Kelly, but maybe that's something that we can ask our attendees afterwards.
Okay, and probably the last question for this part, how can we build up an alliance between physician and patients?
I think this is a really good point from Valeria, and again, Hannah or Francesca can come in on this as well. I think it starts at the top. It starts with us, SAFE and ESO, and working together. But we also do need to reach out and work with other organisations as well. But we are certainly SAFE is certainly going to start looking at that, and we will also work with ESO on that point as well. Hannah, I don't know if you want to address the therapeutic side of things as well.
I think what is really important is that we have the same aims, and this means that basically we're working for the same things. So we should continue to work together to improve the situation for stroke. I don't think that we need to set up an entire new system for physicians and stroke support organizations to work together. At least in my experience, we are already sitting around the same tables and are 90% on the same page, which is basically the way to go.
Arlene, there was an important question coming in. Also, the question was about therapists and nurse specialists and social services. So John Barrick was mentioning that stroke is a multidisciplinary activity. So how do you think are we going to bring these people in?
I think it's a great question. I think also, I'm just looking at the questions as well. Chris Macy has mentioned it as well. I think it's absolutely key to making this happen, that we must make sure that we are encouraging more than or encouraging our nurses and physios together as well. This is something that SAFE feels very passionate about, and we as SAFE will make this happen. But we do need to draw these people into this work as well, and perhaps that's something that we can maybe ask the audience about. How do we do this? But also I think we should address this at the future 3 meetings that are coming up, to make sure we are bringing in the correct people to ensure that we are covering the whole pathway in this work.
Thank you very much, Arlene. In the interest of time, we have to move on, even though this is a very, very interesting discussion, but there will be many more things to discuss. The next presentation is myself. I'm Hannah Christensen. I'm here because I chair the implementation committee for the action plan. When I'm not here, I'm working as a stroke physician in Copenhagen. Next slide, please. Just to remind you, the overarching targets of the action plan for stroke for 2030 from the action plan paper published last year is to reduce the absolute number of strokes in Europe by 10%, to treat 90% or more of all patients with stroke in Europe in a dedicated stroke unit as first level of care, to have national stroke plans for stroke encompassing the entire chain of care, to fully implement national strategies for multi-sector public health interventions. Next slide, please. In the action plan for stroke, we cover the entire chain of stroke care, which has been put into 7 domains. We work from primary prevention, organization of stroke services, management of acute stroke, secondary prevention, rehabilitation, evaluation of stroke outcome and quality assessment, and life after stroke. These 7 domains covers the entire chain of stroke care, where we have to work in order to improve outcome and quality of life for patients and carers after stroke. Next slide, please. The vision we have and had while planning the implementation program includes these issues. The countries of Europe are very, very different. There is no one size fits all in Europe, and a plan that should make change must be able to be applied to the differences of the European countries. The plan should provide a framework for quality improvement work in the individual countries. Focus must be on the most important and evidence-based steps in the entire chain of care, as described. We will provide a platform for benchmarking of key figures because data remains one of the strongest ways of making change. We will engage authorities, healthcare providers, and patients and carers in reaching our common targets. We will, to ensure that this is a plan that is felt with ownership by all parties, finalize this plan together with national representatives throughout the 3 planned rollout meetings. Next slide, please. This figure shows the skeleton of our vision of the implementation. We will have a declaration to ensure commitment and also to define what is it that we want to achieve through this pan-European project or program. We will, and this together with the key performance indicators, will identify the most important, the key targets for this plan. National societies, stroke support organizations, Board of Health will work also on a local basis together with healthcare professionals, decision makers, as well as, and very importantly, stroke patients and carers, and also, of course, work together with what we provide from the Action Plan Implementation Committee, ESO and SAFE. And this will include a Stroke Action Plan for Europe, a SAP-E summary data platform where we can report and benchmark data so that the situation can be depicted and we can document positive change. We will also provide online educational tools as well as a manual to define or list basic evidence-based stroke care. Through these things, we're planning and we will reduce the burden of stroke, and that will happen through prevention, evidence-based care, and support to meet the targets of this action plan for 2030. Next slide, please. One cornerstone of the implementation plan is the SAP-E declaration. The SAP-E declaration has been drafted and will be finalized during the rollout meetings with the national representatives. It covers the vision of SAP-E and describes the cornerstones and the tools of the plan. By signing the SAP-E declarations, ministries of health, stroke support organizations, as well as stroke scientific societies will commit themselves to support and act proactively within the plan in their countries to reach the targets of SAP-E. The SAP-E declaration will be circulated in preparation for the rollout meetings. Next slide, please. Another cornerstone is the SAP-E summary data platform. The key performance indicators I'm not talking about here because these have been drafted based on the domain targets in the action plan, and Dr. Pesela will cover the KPIs in her talk. Data reporting will be like this. Summary data, which will include basic variables as well as KPIs, are reported annually on the SAP-E platform. Only summary data on country level is required, ruling out GDPR issues. Source of data like National Stroke Registry, data from hospital registries, data from ministries of health, estimates will also be reported so that we know how good these data are. Reporting and entering data will happen through a locked system in the REDCap, using the REDCap platform, and each country will have one unique ID for each user, and we will make sure that the workload of entering data will be minimal. Data will then be presented publicly on the SAP-E homepage, and changes over time and comparing countries and regions will be possible. Data remains probably the strongest tool to identify areas with need of improvement and also seeing the improvement when changes are made. Next slide, please. As to the country involvement, because this is basically something where what matters will really happen in the countries, there are 3 points of contact. These are the stroke scientific societies, an election of a national lead will happen through these scientific stroke support societies, and they will support this person in communication and delegation, contributing to the national stroke plan, setting up a country-based SAP-E networks and work groups, ensure user involvement by involvement of SSOs, chairing the country's SAP-E monitoring and benchmarking board, providing summary data, and communicating needs like care facilities or whatever to the Ministries of Health. The stroke support organization will communicate needs, contribute to national stroke plans, and also provide input on benchmarking results and be involved in the entire process. Ministries of Health will support the work of the national lead, provide a national stroke plan, ensure collaboration of all sectors involved in stroke care, initiate and provide support for quality programs nationally, support provision of summary data for SAP-E, as well as supporting the annual meeting with the National Coordinator on benchmarking results. Quality of care happens in the meeting with each individual patient. The real work is what is done in the countries. Next slide, please. The tools we will provide for the SAP-E implementation plan are, at least the most important of them, outlined here. We will provide online learning material. We have compiled existing learning material based on languages and areas, as well as a way of listing ongoing education, and we'll present this on the SAP-E homepage. And we will make sure that there's learning material for all health professions, as well as for patients and carers. The basics in stroke care, we have made a listing of with assistance from the Guideline Board of ESO, of the most important issues from the pre-hospital phase to the life after stroke phase. These are all based on recommendations in evidence-based guidelines. This document will be shared with everybody when finalized. We will hold the rollout meetings where we will share our thoughts, and we will go into details on all parts of the program and finalize this in communication with the representatives from the national societies and the stroke support organizations. We will also provide facilities on the SAP-E homepage for sharing of experiences, questions and comments, etc., aiming both at healthcare professionals but also at patients and carers. We will support the contact to Ministries of Health to underline that this is a European effort and also to support people in the individual countries. We will also communicate at a European level and within our strategic framework, also including such parties like existing quality programs, not to mention regional WHO. Next slide, please. Everything will be applied based on countries' needs. There's no one size fits all, and like making the same benchmarking for all European countries would not make sense, because we have different problems, we have different resources, and also within the 7 different domains. So this will be finalized based or within the countries. We have also to take into account the differences we have in organizations and cultures. But this does not affect the fact, and what is why we're all here today, we have just one target in this, and that is to reduce the burden of stroke by improving prevention, treatment, care, and also making life after stroke better for both the patients and their carers. Thank you.
So, Hanne, thank you very much for this excellent presentation. There is already a first question coming in. The first question was, what are the major challenges in implementing the stroke action plan?
Well, I think there are a lot of challenges, and I think these challenges differs between countries, because I think, of course, if we take the basics, the economic situation and the situation in the healthcare systems vary between countries. If we look at like what Arlene also referred to, there are massive changes in the level of care between countries. So this means that in some countries, actually having the option of having stroke care may be the major question, while in other countries, the problem may mainly arise in going from the hospital sector to the community sector. So I think the problems in this phase are different between countries. But I think that there's one thing that we all have in common, and that is that stroke has been under-prioritized for decades, probably because until recently there's not been so much that you could do about stroke. And secondly, there has been this misunderstanding that stroke is something which happens very, very late in life and is often a kind end to misery, which is completely wrong, but has been held by many physicians too.
Great. Next question, will COVID have an impact on the implementation of the stroke action plan?
Certainly. I mean, we would have held this meeting as a face-to-face meeting and not as a Zoom meeting if it had not been for COVID. And rolling out a pan-European program by Zoom meetings is certainly something, to my knowledge, nobody have ever tried before. So certainly, yes. But on the other hand, I think we can still manage.
Right. There was one participant asking, the national lead that you mentioned, is the same person responsible for stroke quality improvement mentioned defined in the targets, or is this a different person?
We want a national lead in the country who is basically responsible for things getting done, but will have the option of delegating and the duty of involving both scientific societies and stroke support organizations. We will talk much more about that during the rollout program, but I do hope that the people who are here today are people who are ready to involve themselves also as national leads and who also have the mandate from their countries to be involved in this process, and I certainly think so.
There was a question from Professor Touset from France. How do you expect to convince ministries of health to implement a national stroke plan?
I think the best argument to do that is that there's a very, very high level of cost effectiveness in stroke care. So basically, if you give a good stroke care, you will save money. The second argument is that this will certainly improve quality of life for very, very many people. And also to keep the cynical view of it, these people are also voters. So I think that improving stroke care is a win-win situation for everybody. So
Right.
We just need to bring out the facts. And that's what we can help doing in the implementation committee.
There's another question from Dr. Flomin from Ukraine. In many countries, stroke still seems a low priority. What can we do about it?
I think that we need to put focus on stroke. I think we need to bring out information on the options of both preventing and treating stroke as well as improving life after stroke. And I think we need to keep focus on the fact that this is cost effective and has massive benefits on quality of life, not only for those who have had a stroke, but also for their carers and society. So I think we need to bring out the information and ensure it gets out not to the public and to the decision makers. And that is basically what this program is about.
Excellent. There's one last question before we move on to the next speaker. What is your experience and suggestions regarding European certification of stroke units?
I think this is a very, very important point, because you need to have some kind of being able to monitor quality, because otherwise stroke unit is just a door sign. There are basically two different ways you can monitor this on, and one is to do key performance indicators and look if care is provided. The other option of doing it is certification of units showing that these units have the competences and the means to provide good stroke care. I think that both methods have shown to be very efficient, and in my opinion, as countries are different, and we should not, like, you know, I of course think the Danish model is wonderful, but I'm certainly not going to try to bring that to Germany. We have another wonderful model and are able to provide very, very good stroke care. We should use the models that already exists, support people in ensuring that there is some kind of quality monitoring program, and help the countries that do not yet have a program to implement one. And then we have the SAB-E monitoring program, which will allow for benchmarking across Europe. Hope this answers the question.
Excellent.
I think we have to move on.
Yes, there are no further questions, so we are coming now to the next speaker.
Now it's my pleasure to introduce Dr. Francesca Pesella. I can hear somebody.
Thank you, Anna.
Yeah.
Yes.
Who will explain the key performance indicators so far, because this is also still work in progress. Looking forward to hearing your talk, Francesca. Can't hear you.
Yes, can you hear me now?
Yes.
Oh, great. Perfect. Sorry, some home music maybe. So thank you very much, Hanne, for your kind presentation and introduction. And now I'm going to walk you through the key performance indicators that were identified till today. Next slide, please. And as Professor Christensen has explained, the action plan aims to cover the entire chain of stroke care. So from primary prevention through the acute phase to rehabilitation, secondary prevention, and life after stroke. That's why we have identified key performance indicators that are useful and that can be used to monitor and feedback clinicians and stakeholders on the current implementation of the action plan. It's a model of self-help somehow that is structured around KPIs. As I said, there are 10 KPIs that have been identified till today. There is an 11th one, which is about rehabilitation and life after stroke, and SAFE group is working on it. Next slide, please. In this slide, you can see the key performance indicators, the quality key performance indicators. So those that somehow don't require a quantitative measure. The first one is about the existence in your country of a national strategy for multi-sectorial public health interventions promoting and facilitating a healthy lifestyle and risk factor control. The second one is about the existing, again, yes or no, national stroke plan defining pathways, care after stroke. The third one is about the establishment of national and regional level system for assessing and accrediting the stroke clinical services and providing peer support for quality improvement, organizing audit and making this audit data available to the public. The fourth one is very interesting, also from the Italian point of view, because it's something that has been done in the last years, and I'm very curious to hear about the experiences of the other country. It's about the participations of individuals from the stroke support organizations. So if, of course, they are existent in that country, in an equal way together with, and their involvement in an equal way together with the professional society representative during the development of country national stroke plan or country guidelines. Next slide, please. So the next 6 KPIs are quantitative KPIs, and Anne has said, there is no one size fits all in Europe. So the numbers, the figures are somehow decided by the single countries. The single national representative together with the other stakeholders will decide which is the figure that they want to consider annually. So the first one is about stroke unit and stroke services undergoing auditing within a regular interval or continuously. So what we want to know here is the percentage of audited services among the certified ones. The sixth one is about the percentage of patients that are admitted into a stroke unit or a stroke center within 24 hours from stroke onset. The seventh one is probably one of the most critical, as it concerns recanalization treatment rate, and it's the percentage of patients receiving intravenous thrombolysis or mechanical thrombectomy calculated out of all ischemic stroke admission. Next slide, please. The eighth one is about the stroke workup. So the percentage of stroke units that have access to neuroimaging, ECG, long-term ECG, cardiac echo, whether it's transthoracic or if it's transesophageal echocardiogram. Dysphagia screening and blood testing during the patient's stay in the stroke center. The ninth one is the access to early rehabilitation. So we want to know the percentage of patients that have access to early rehabilitation. The 10th is about the percentage of patients that have access to basic secondary prevention, including, of course, antithrombotics, antilipemics, antihypertensive drugs, and antithrombotic drug. The 11th one is the one concerning life after stroke. Next slide, please. And so what we would like to do together with you, national representative, is to help you setting the right target for each year, for each KPI, in order to use it to monitor the implementation of the action plan for the next 10 years. And audit this data, upload the data annually, audit them, and see where are the gaps in order to adjust the national strategies and to reach the targets that the European Action Plan has fixed. The Action Plan committee is supportive. There is educational material available. There will be it's going to be discussed in the next meetings, and so I think it's a good opportunity also for you today to start thinking about these tools. And now I'm open for any question. Thank you. Next slide, please.
So thank you, Hanne. Sorry, Francesca, Romana, sorry.
Don't worry.
and for the great presentation. So there's already a first question coming in. The suggested KPI do not cover rehabilitation and chronic care. Is it possible to suggest a 12th KPI? Can we still modify this action plan?
The KPI work SAFE is working on is about life after stroke and rehabilitation as well. So it's probably also for them a good suggestion. And as soon as that KPI will be ready, we will include it. And of course, this is a draft, so we're open for discussion.
Excellent. I would like to remind everybody that you can use the chat function and asking us a question about the implementation. You can also ask questions not only to the person who is speaking, but also to previous speakers. So if you have a question which could not be answered, please use the chat function. There's another question coming in. In the next future, we will have, I hope, regional, national committees with patients and professionals related to the stroke action plan. Which kind of recognition will give the steering committee?
I didn't understand the question. Which kind of what?
Recognition will give the stroke action plan steering committee.
Acknowledgement.
Yes.
I think the main acknowledgement. Is that correct? The action plan steering committee is going to acknowledge those.
We plan that on the homepage that all the national leads and other people involved in the committees will be mentioned under the countries. Our idea is that we're going to make maps of Europe, so that if you click on a country, like if you click on Estonia, you will go to see a list of who is working with the action plan in these countries. So it's very important that people are acknowledged, because otherwise they're invisible. And it's also important because otherwise how would anybody find them? Not just to say thank you for your work, but they need to be visible. So certainly that will happen.
Great. There is another question coming in from Dr. Flomin from Ukraine. Dear Francesca, what tools do you suggest colleagues to use in countries where the national stroke registries are not available?
Well, the KPIs, the role of the KPIs is exactly this. We will have a certain number of KPIs. To date is 11. And as I said, there are qualitative and quantitative KPIs, and there will be a platform where the country representative for the action plan can upload their data, and so they can use this platform to monitor the evolution of their work through the KPIs. So for each year, they are called to decide what is the target they would like to reach, and uploading the data, they can monitor and feedback their colleagues, their stakeholders, and see if there are gaps or if the work is going the right way in order to implement the action plan.
Francesca Romana, can I add something?
Of course.
Yeah. I think it's important that we are aware that only a minority of the countries in Europe have stroke registries. So this means that countries will report the best data they have, and then they click what kind of data this is. If this is stroke registries, if this is from ministries of health, if this is from DRG registries, if this is even estimates. So you report the best you have, and then you click what kind of data.
There's another comment coming in, and it's addressing a little bit the national policy, but also the European level. So the question was, mobilizing stroke organizations around Europe to lobby for change is ambitious and admirable, but a plan to make stroke a health priority at European level can also do much to support national efforts. How is this going to be addressed?
This is going to be addressed by a common effort from the parties involved in the stroke plan. I know SAFE is already working on it, and ESO has also worked on it, and we're going to work on increasing the priority not only at an EU level but also at a WHO level. The person who posed the question is completely right, that we need to get this set, to get this very public, to get a lot of attention to this. And you're right to be impatient, but this is, and I am impatient, and I already feel ashamed because everything has not yet happened, but this is the first kickoff meeting, and this is exactly what we're working on.
There is a further comment coming from Slovakia, from Professor Dovina. She was asking or adding that the evaluation of quality results is important, but she also mentioned that it is important to talk to the public, to perform public presentation. What is the aim of the action plan, or how would you like to implement this?
I don't know if the question is about acknowledging the work of the action plan at a national level, but I think it's the action plan offers a very good opportunity for the national societies to show internally what they are doing. And so somehow there was a question about lobbying around Europe, but this is also an opportunity for you to show that you are part of a greater picture and you're acting within a very defined framework where there is a unique opportunity to join one effort to reduce the burden of stroke in Europe and in your own country. And I know about the stroke registry that is in Slovakia is exceptional. So I think it's for you also another reason to show to the stakeholders what are the results, the good results you're obtaining. So there are different levels, as Hanne said, where you can act. If you don't have the stroke registry data, use other data, just clarify what data you're using, but whatever you're using, just show them that you are part of a greater pictures and of a bigger program.
Yes, and eventually the next presentation is just a good move to the next presentation, because during the next presentation we will address the status of the registries throughout Europe. So there are no further questions. I would like to hand over to Hanne.
Thank you, Urs. And I now have the pleasure of handing the work back to Dr. Diana de Souza and Professor Urs Fischer to talk about the monitoring the progress of the SAP-E targets mapping of stroke care in Europe, to hear your preliminary data. Please, and thank you for joining us today.
So thank you very much for the introduction and good afternoon. So now we would like to give a brief overview on what is planned in order to monitor the progress of the stroke action plan targets, which is definitely, as we have heard, a most necessary step in the successful implementation of this plan. And also on behalf of Urs Fischer, who is the coordinator of this task, I will show some preliminary data collected so far. Next slide. So we already heard the main stroke action plan targets and the KPIs before, so it is very easy to understand that in fact we will only be able to know whether we are achieving our goals or not if we are able to measure those variables related with stroke care. So this measurement is absolutely crucial if we want to improve, because it will allow us to understand how we are performing, what should be our priorities, and also to show our national stakeholders and European stakeholders and policymakers what has to be done, as we discussed. So this is a major goal of the stroke action plan. But then how do we plan to accomplish this task? So the first step, as you already know, was to identify and define this network gathered here today, and which includes the main stroke societies across Europe and stroke support organizations, has the primary representatives of stroke professionals and stroke survivors in each country. Next slide. So as you know, to do so, we contacted a high number of stroke experts across all Europe using the ESO contacts and also contacts from previous surveys. And we requested this information on which were the national professional stroke organizations in their countries and who were the chairs and the main contacts of those societies. And then to confirm this, we have contacted again directly the societies And we have collected the contact persons related with this plan, and also we have confirmed that there were no other relevant stroke societies in the country. Next slide. So finally, we are happy to say that we were able to establish collaboration with stroke societies from all the WSO European region countries. As you know, there includes some countries also in Central Asia and Israel. And that are here represented today, except for 3 countries, which are here marked in red in the map, which are Tajikistan, Uzbekistan, and Turkmenistan. But all the other countries we have here today, and we have established this collaboration. Next slide. So more specifically, we have 53 national scientific societies involved in stroke care in these 49 countries, meaning that we have 3 countries that have two societies actively involved in stroke care, and also another country, Spain, that has also an important large regional society. So most of these societies, we are happy to see that they are already actively collaborating with stroke support organizations, and also that most societies feel they represent stroke physicians and professionals towards the national authorities. Next slide. Then after defining this network, we proceeded mapping these existing stroke registers and other sources of surveillance health data related with stroke. So as you know, we have contacted you, the scientific societies, in order to know if there was a national register already implemented or planned in your country, and also whether other entities were currently collecting surveillance health data related with stroke. And finally, our aim is to create this network of experts related with these registers and data collection, and support them in the process of developing these methodologies so that data across Europe regarding stroke is progressively more comparable and more accessible to everybody. This some of the activities that we plan to do to improve this data collection is to define core items for data collection, also to improve and standardize the coding systems and the definitions so that data is progressively more comparable, promote this collaboration between national registers and regional registers, establish this harmonized system to collect and display aggregated data, and also, of course, in countries lacking appropriate stroke registers to help them to collaborate with other registers and to be able to implement this data collection. Next slide. So now we are happy to show you the preliminary data results on this mapping of stroke registers and other national databases. We are only missing 2 countries, the answers from 2 societies, particularly Russia and Armenia, that are here today as well, and which we expect to receive soon, but we will show you the results from all the other societies. So far we have a notice of 20 registers, 20 countries that have a national register, and also 14 countries reported to have 1 or more regional registers. We are also happy to see that many countries, especially those not having a national register already in place, they have other sources of public health surveillance data, many times in collaboration with governmental bodies and authorities and within stroke action plans in place nationally. Next slide. So here we can see the distribution of the national registers, and as we can see, they are mainly implemented in Central European countries, also Scandinavian countries, but also the UK, Ireland, Spain, Turkey, Italy, Israel, so several other countries. However, these registries obviously have different features, which we will still explore more in the future. For example, Italy and Turkey, these are registers involving only patients receiving endovascular treatment, so they are still not registers universal, that are universal to all stroke patients. Next slide. There are also other differences. For example, while some countries have independent national registers, some other countries, for example, the Czech Republic, has a wide participation in an international register, which is RESCUE, and which works like a national register because the participation is very wide, but still is not an independent national register. So there are, we see there are different ways of implementing this type of data collection. Next slide. Also, as I said before, we are happy to see that many countries that don't have registers still are collecting several relevant indicators related with stroke care as part of public health surveillance data, within national stroke programs and together with national authorities. Next slide. So in conclusion, we have definitely a very broad range of sources of information on relevant indicators, both from national registers, but also regional registers, international stroke registers, public health surveillance data, and also we have the possibility of collecting aggregated data across stroke units and comprehensive stroke centers to make estimates for some of these relevant KPIs. Of course, there is lots of room for improvement. We can improve and standardize the coding systems and definitions and make data progressively more comparable, facilitate collaboration between national registers and other types of registers, and promote and support the development of new registers. Next slide. So we believe the collection of this data will be crucial because it will allow us to compare performance indicators across Europe, which allow us to understand which policies are related to best performance, what should be our priorities, and also importantly, we can use this data to influence national and international policymakers and stakeholders. Next slide. So thank you very much, and we will be happy to discuss this and to answer any questions.
Thank you, Diana, for this really excellent presentation and for your massive work in compiling this. I'm really impressed.
So Diana, thank you very much for the presentation. There are already questions coming in. First question, what are the next steps? So what will be done in the next few weeks, months?
So our plan now is also to contact these registers, which we are just finalizing the list, and just be acquainted with their features, whether they will be interested in collaborating with other registers, for example, sharing variables, sharing definitions, and increase the standardization of the variables and the definitions so that data is more comparable. And of course, we can start collection of data for some specific variables that are already being collected in most countries within registers or outside registers. And of course, as we saw, the public health surveillance data can be also an important source of information. So connecting with ministries of health and this type of authorities can be also helpful, both through the national societies and through the European level.
Thank you very much. I just would like to remind all participants, please use the chat function. Please ask questions. It's also for us relevant to interact with the community. There's a second question coming in. What can we do to promote registries in countries lacking those registries?
Yeah, that's a very important task for us as well. Obviously, we can facilitate the connection with the existing registers and the collaborations we aim to establish. Also, this type of web platform that is being developed can also help to promote this type of data collection of very specific variables, at least as a start. And of course, sharing the data variables, the definitions can also be helpful for those starting to collect data at a national level or with more or less coverage at the beginning.
As you have mentioned at the very beginning, there are 3 countries where we don't have a contact person. What are the 3 countries? Can you remind us, please?
It's Turkmenistan, Uzbekistan, and Tajikistan. So if anybody, we are still working on finding contacts in these countries, but of course, if anyone knows stroke professionals there, that will be very helpful for us because definitely there's...
absolutely, that's a call to everybody. Please, if you know somebody within these countries, if you have a contact person, please let us know, because for us, as you have realized in the past, we're very picky sending you a lot of emails, and we need this contact person, otherwise we cannot measure. There is another question in the chat room. Are you preparing guidelines on creating a stroke registry?
I think that's a very good suggestion. We will we aim to establish this network of stroke registers. So probably they are the best suited people to tell us how is the best way of creating a stroke register. And if they are willing to have some even sharing the data definitions and so on, we can definitely have work on that published so that it is accessible to everybody working on this task.
Great. There's a further question saying that there are already registries including SIDS, Rescue, and then there are also national databases. And the person mentioned it is difficult without dedicated research nurses to include patients into different registries. And the question was coming up, is there a possibility to create a dedicated one registry for European countries to promote it?
So the KPIs are only, as you saw before, and if they are still the same if going forward, that they are aggregated data. So they are not focused on specific patient data. And that is helpful. That means that we can use whatever source you are using to introduce this and to analyze the KPIs. So there's no need to replicate registers. Of course, European registers has Rescue and maybe others, and SIDS and other types of international registers, of course, is a very useful way for countries, especially countries lacking national registers, to have a simple way of introducing data. And if the coverage, like for example in Czech Republic, if the coverage is very large, it works like a national register.
Right. And there's a last question from Professor Andanova from Bulgaria. What do you think is more beneficial, implementing local country-specific stroke registries or using one standardized international registry for all countries? And we need equal variables in the registries.
Yes, that's a good point. But of course, at the country level, many countries feel the need to have a national register, which has many advantages because there is an homogeneity across the country and many specific ways that healthcare is dealt with. So, of course, there are advantages in international registers and national registers. The international registers, the variables are all coded the same, so it's very easy to compare across countries, but almost always the coverage is not complete, contrary to national registers, which are very much within the national health system implemented. So definitely, I think that depends on the country and the specific features of the country.
Great, thank you very much. There are no further questions. I also would like to thank all participants for sending us data. It's very important for us and we're really very grateful. So Hanne, please.
Thank you, Urs. Now I'm going to introduce our last speaker, Professor Bo Norving, who will talk on action plan in a global perspective. Unfortunately, Robert Mikulik was not able to join us today. So please, Bo.
So Hanne and all, thank you very much and good afternoon. It's my pleasure to speak to you about the global perspective and look more on what are the players, what are the different players, what are the other things that we need to have in concern in an action plan for stroke. So if I can have the next slide, please. This is a principal slide showing in the circle in the middle the different stroke organization and also the patient organization, the stroke support organizations. So here we have ESO, of course, we have World Stroke Organization, we have SAFE as an example of a patient organization, and we have many other organizations, regional and national organizations. We have also sister societies in related fields. I put it here, the World Federation of Neurology. We have also the World Heart Federation. We have the NCD Alliance, which also have stroke as part of their agenda. So there are a lot of different organizations, some of global level, some of regional level. We have the stroke support organizations. So what is the role of this organization? Well, basically to provide advice, expertise, and consultation. But the problem is that the organizations do not have the decision rights when it comes to resources. And this is why we need to reach out to the other players, to the other important bodies. So we need to reach out to the health professionals about knowledge, about guidelines. The guidelines, you know, is now a prioritized feature of the European Stroke Organization in the near future. And extremely important here is the context with the ministries of health. I will come back to that, but it's important fact that every country is autonomous when it comes to healthcare. Make their own decisions. If you want to reach the national level in competition with other diseases, in competition with the pandemic, in competition with cancer and heart disease, and in the resource allocation, you need to come up on the Ministry of Health level, on the national level. And this is why it's so important that we have this meeting today with national representative who needs to reach out to this level. And then you have on the left side, the next level, that the Ministries of Health in the different countries are members of WHO and is a regional offices of WHO, which is located in Copenhagen for Europe, and is a WHO headquarters for the world, which is located in Geneva. So here it is important that the World Stroke Organization got into official relations as a partner with WHO in 2005. And this year, very importantly, ESO made it also to come into official relation with WHO Office for Europe in Copenhagen. This is a major achievement. It's very, very important for the possibility to reach out with the arguments. And also stroke is present at the UN. As you know, it was a 2011 declaration of the non-communicable diseases. Stroke was part of this, and stroke is also part of the Sustainable Development Goals of 2015, and there will be follow-up on this, and W as a representation here in the ECOSOC Council. And if we go to the right lower part, we have also connections with the general population, and these include patients, carers, and also the general population, where we need to inform about stroke, where we need to inform what to do if there is a suspected stroke. So I think what has become more clear during the last year is that these are the players, this is what we have in our hands, what we can do, but we cannot do it alone. We need to reach out to the other levels to be effective. And I think this is very important to recognize that what is our task? Where do we need to collaborate? In what ways can we collaborate? So the next slide is an important chain of arguments that I propose that we should use for stroke, not only for stroke, but actually for all diseases. But what we have first is to demonstrate the size of the problem. And I think one lesson here that we have learned is that it's not enough just to say that stroke is a big disease. We have this and that number. We cannot even grasp that number. It's so huge that we cannot really grasp it. But we need to have this as a basic fundament that what is the size of the problem, but this is not enough. We cannot compete with other diseases just to say that stroke is more important than other diseases, because every disease can argue in that way. The second thing is refer to an evidence-based source document and an action plan. Now we have the European Stroke Action Plan. We have it collected, we have the evidence-based, we have the priorities, we have the action plan on what to do, so we can have this well coordinated. Third step, to demonstrate the gaps and inequalities in the occurrence of stroke and in stroke services. And this we see an example of that at least half of all stroke patients in Europe do not have decent basic care of stroke. The proportion globally is even lower than that. So it's huge gaps, it's huge inequalities that should not be acceptable. A fourth argument, show that substantial improvements can be made. We know that we can prevent stroke, we know that we can treat stroke, we can make a huge difference by implementing this. And the fifth point, demonstrate that actions are extremely cost effective for the society. The sixth point, to measure progress, surveillance and quality of care, like we have come across in some of the other talks. And I think what is remarkable and fantastic for stroke is that today this chain of arguments is so extremely strong for stroke. And I would even say that this is stronger than no other disease that comes up to this level. We know that it works, we know what to do, we know that it will deliver, we know that it is an investment, and we can show that we are doing good things by implementing good stroke services and preventing stroke. So I think we should keep this chain of arguments in mind in our work, and this is logics when we are working really. So the next slide, this is the same chain of arguments that we use at all levels. When we are speaking of stroke on the global level, it's these arguments that we use. When we do it on the regional level, like for Europe, this is the same arguments that we use. And when we come on the country level, these are again the same arguments that we use. And it needs to be improved in every country in the world. There is no country today that has perfect stroke services. It can be improved, it can be much better. It needs to improve everywhere in every country. And in the square, you see this important fact that each country is autonomous in healthcare decisions. And that means you need to come down to the country level. It doesn't matter if we say something on a European level. We know that, for instance, when it comes to the pandemic and how to deal with that, we know the dealing with the climate change and what different countries do, that every country has a decision right finally on what to do. So we need to come down on the country level, and we emphasize in the Stroke Action Plan the importance to have national stroke plans, which is so important and one of the real key targets. So the final slide shows that we need to work together. We need to be aware that this is part of a bigger action. We have the UN, we have the WHO, we have the Ministries of Health, we have the Stroke Support Organization, we have the patient organizations here that needs to work together in this. There are other stroke action plans, for instance, the Latin American plan for stroke, which was published in Lancet. And there are also other initiatives ongoing. I think one very important thing here is that we need to learn from each other. We need to look at the good examples. For instance, the question on how do we set up a stroke registry? Well, it's been done in other countries. You can clone it, you can take it over, you can get good advice. We have good examples. You do not need to reinvent it and start from scratch. We have already the good examples. So we need to have a very good atmosphere between the different stroke society. We need to work together, and it's extremely important. Those of you who are present here today from the different countries, national level, the country level is extremely important. So with this word, thank you for your attention.
Thank you both for this very clear and important talk.
Excellent, thank you very much. There is already, yes, a question was coming in. First question is, how should we attract the attention of the authorities and the community to stroke in the middle of a pandemic?
I think this is particularly important during the pandemic.
Oh, can you hear me?
Yes. Yep, you hear me?
I can hear you.
Yep. I think it's a very good example how a stroke as a disease can be affected by the pandemic. Importantly, we have seen how fragile what has been built up for many years for stroke to get to the hospital, to have the basic stroke services available, how easily this can be teared down by the pandemic. And I think this is a real lesson. Another lesson is that if there is any time that we need monitoring of the quality of care for stroke, this is during a strain of a pandemic, really. And this is really a challenge.
Thank you so much. I would like to remind you that you can ask questions using the chat function. So you can ask questions not only to the speaker, but also to previous speakers or the steering committee. There is one question coming up. Are there plans for continuous updates of the stroke action plan. The current version is 2018. ESO page looks not updated much. If we want to contact national health authorities, it would be helpful to have something more current.
Thank you for this very important comment, which we will take into account into our further work. Thank you very much. I can see one more question popping up.
There's a next question coming in from Dr. Flomin to Bo Norving. Do you think we can take advantage of the Angels initiative? Do you think it can be helpful?
Absolutely. And I think Angels is one example of how to really improve the quality of care in a region. It's a very, very successful example. I think it's a good example of how improvements can be done. This is very impressive work and a very good example.
Further question from Professor Peter Kelly. It's again the question about the distribution of the European on a European level and on a national level. So the question is, even though each country is autonomous for health decisions, how much soft power can the European Union bring to bear in Europe?
Well, thank you, Peter. It's a very good question that I think we should make use of all contexts and all platforms and fora that we have available. One of them is, of course, EU, which can have an important function. I would say that WHO is probably even more important because it's ministries of health there who have direct contact under WHO, but EU is also a very, very important body, though it doesn't link directly with the ministries of health like the WHO does. But it's important to be visible everywhere, showing that stroke is a big disease, we can do it, it's cost effective, and it will work.
Okay, thank you so much. There are no further questions, so I would like to hand over now to Professor Hanne Christensen.
Thank you very much, Urs. All that is left is a wrap up and a few words on the next steps. Please, next slide. Today, the conclusions from today are that we have done a kind of a good mapping of the existing situation. We've heard from Aline about the unmet needs in Europe. We have not, unfortunately, Robert Melkick was not here today, so we've not heard about his experiences from ESO East. And we've had an overview and a resume of the SAP-E program. And we actually did have a lot of good inputs and discussion. As you can see, I did these slides in advance. Next slide, please. The next steps will be the rollout meetings. You have already all received the dates, which will be in November, December, and January. Please remember to register. We will send you detailed agendas soon, as well as all meeting materials will be sent out approximately 2 weeks in advance. Also, please visit and spread the word about the virtual SAP-E stand at the WSO ESOC, where people can log in, or however you access it, I assume, and see a lot about what we're intending to do and hear about a lot of people's experiences with improving stroke care. You will also be able to revisit this event or share it with your colleagues, as it has been recorded and will be posted on the SAP-E homepage. If there are any questions or comments, please contact this email address, which goes to the head office, where that takes care of dividing the questions to the person who should be contacted. And finally, thank you so much for joining, and thank you so much for your activity and for your very, very good questions and input. Thank you.
Thank you very much.
And now it is 4 o'clock. So unless there's any questions to these next steps, we will close the meeting. Urs, do you have you received any questions on the next steps? Can't hear you.
No, I have a lot of thank you and bravo. So a lot of congratulations to the team, but no further questions. Thank you very much.
So thank you all very much for joining us today. I'm personally looking very, very much forward to the rollout meetings. Thank you. Bye.